Kimberly and her 2 daughters take 4 insulin injections a day. A drop in blood sugar while they sleep could prove fatal, so Kimberly has to get up during the night to check everyone's glucose levels.
If I don't have my husband, I have to have someone else with me during the night, because sometimes I can have really bad low blood sugars during the night, which I don't feel. No, I don't feel it at all, so that's why I always have to have someone with me.
3 years ago, Kimberly had a pancreas transplant and thought her days of insulin jabs were over. But last November, her body rejected the organ. Another transplant would be very risky, but in this lab they're creating an alternative. Scottish medics are developing a technique which extracts the insulin-producing cells from a pancreas. The cells, called islets, can then be injected into a patient under anaesthetic. For type 1 diabetes sufferers, it could one day become a cure.
Clearly at present there will be a minority of patients who will be insulin independent, but I think this is the first step in a programme for Scottish patients, and I would hope that we aren't looking too far in the future really to achieve a stem cell transplantation for diabetes.
How would it be for you one day if you didn't have to take injections?
Good. It would be amazing to think that I would get up in the morning just not thinking about like having jags and blood tests.
Initially, only 12 patients a year will be able to receive the Islet treatment, but for the 30,000 type 1 diabetes sufferers across Scotland, like Kimberly and her girls, the work going on in this lab offers the hope of not only an injection-free life, but a full night's sleep. Debbie Edward, STV News, Edinburgh.